Who should walk? Well, I think, again, an encouraging finding is most adults recognize that they should walk more themselves, and most parents of young children agree that their children should walk more. So I think this suggests that people see the relevance of the pro-walking message in their own lives, and that they're taking personal responsibility, that it's up to them to make it happen and achieves benefits for them. This is not an abstract concept that walking is good for people in general. I think the data is saying, people are saying, this is good for me. I should be walking more myself. Another who question is really who encourages you to walk. And I think, we see at the top of the list there, personal context, people who are reinforcing a walking message on a personal level. Family members, healthcare professionals, friends or acquaintances are important influencers, like, roughly 3 in 10 of the people hearing that message from those places. The media, too, is on a par with that, about 30% saying that things they've read or heard in the media encourage them to walk. And I know this may be discouraging for some of the people representing organizations in the audience, but the survey is showing that for the most part, Americans are not hearing from organizations, whether that's the company they work for or for organizations in their community, the message that they should be walking more. Those are in the single digits there down in the lower end. And now that final statistic, 33%, is, I think, a little bit of a mixed bag on how to read that, in that a third of the people say, they were encouraged to walk by no one in particular, they just decided to walk on their own. Which, on the one hand, I think that's good news, in that it shows some people don't need motivation. They don't need to be encouraged. They're already doing it and will do it themselves. And of particular relevance on this question, at a conference sponsored by Kaiser and with a lot of medical community people present, I just wanted to call out that 58%, a pretty solid majority, say they would walk more if a doctor told them they should. So clearly, doctors can play an especially important role in encouraging people to walk more. As you tell people that they should be walking more and encourage them, the question you might hear is, well, what do I need to do? What do I need to do to get the benefits of walking? And as I'm sure most of this audience knows, the CDC recommendation of 150 minutes a week, is one threshold of getting some health benefits from walking, and more specifically defining that as 30 minutes a day in at least 10-minute increments for 5 days a week. So we asked people, defined that standard for them, and said, this is a level of walking that, do you think you could do that? Would that be difficult to attain? And most said no. Only, again, about 10% said it would be very difficult to meet that, which is roughly that same 10, 12% I mentioned before of people with difficulty walking. 28%, for whatever reason, social, environmental, physical, say it would be somewhat difficult, but fully 50% said it would be not too difficult or not at all difficult to meet the CDC standard. And 11% there say they already are meeting that standard, so this is nothing new to them. So I think that's all good news, that most people, if you're encouraging people to walk more and to meet that CDC standard, recognize that you are asking many people to do more than they're doing already, but you're not asking them to do something that they largely think is unreasonable or unobtainable. This is seen as doable by people. And you might recall that earlier, as we have 11% here that say they are already walking as much as the CDC recommends. And you might recall earlier I said 43% said the main reason they don't walk more is that they perceive they already walk enough. I think what that suggests is there's a real gap there, a discrepancy in public perception of what it means to walk enough. That only 11% are meeting that standard, but 43% think they are already doing enough. So that perception about walking more and meeting this standard, which, again, the public by and large is saying is doable, that's a perception to really focus on, I would think. How? I won't spend much time talking about how to walk, because unless you're aiming at that under 2 demographic, I think you're Most Americans already know how to walk. But not only do they already know how to do it, most are already doing it regularly. In fact, it's when we ask a list of physical activities, are you doing this? Walking is far and away the most common regular physical activity people are doing. So again, encouraging walking is not asking people to do something unfamiliar and difficult. It's simply asking them to do more of something they've done every day since they were a toddler. The real how question then might be, how do we make communities more walkable? I think we see here, this is where we get into a little bit more, and I realize this is very hard to read from a distance, but very quickly summarizing that the first two items there are asking, would you support community efforts to design, streets with sidewalks, crosswalks, and other walkability factors? And would you support better enforcement of speed limits and traffic laws, even if, and this was phrased in the question, even if it meant, requiring, slowing down driving slower? Pretty large majorities agreeing with both of those sentiments. Those steps are something people support. The two middle items there with the, a small majority agreement but more divided opinion is designing communities to be more walkable in the sense of, smaller lots, closer in, more convenient destinations for jobs and stores and things of that sort, and using more government transportation funding for public transportation to eliminate that door-to-door walking, door-to-door driving that helps minimize walking opportunities. Again, small minorities supporting those opinions, but reasonably close split in the opinion on that. On the question of increasing government spending to make communities more walkable, even if it means higher taxes, that's where a majority goes against it. You have a 37% support such an effort, but 60% would not approve of that. So where do we conclude looking at these questions and answers? And I think there's a few key takeaways here just to emphasize. Key takeaway number one is the public gets it. The public agrees that walking means health benefits for them. And I think the finding that relatively fewer people are motivated by the practical and social sides to walking and the environmental side creates a messaging opportunity that you can focus more on linking those ideas, those advantages of other advantages of walking on convenience and environment and so forth in the context of, you already know it's good for you. It also has these other benefits as well. And I think emphasizing that walking is easy can help address the gap between motivation and action. Because obviously there's a big difference between believing in general on a survey that yes, walking is important and is beneficial, and actually following through with the behavior to do that and reap that benefit.